Good morning. Joe Blas from Prisma Health in Greenville, South Carolina. I'm going to present 3 cases to you very quickly today that hopefully show you the versatility of this device for patients with very bad problems. So I'll get on. The first patient we have is a 64-year-old woman, history of COPD, COVID, diabetes, kind of a very routine patient demographic that we see in the biscuit belt of the Southeast. Probably similar to some of the patients that you face. Lifelong non-smoker and no relevant family history. She presented with a 5-day history of acute onset left lower extremity pain, left foot pain even at rest. She had actually had a right popliteal artery aspiration thrombectomy approximately 8 weeks prior via a left groin approach. And there you note her physical examination. So she's morbidly obese. She's got 2A ischemia. She has a gangrenous left first toe and only has pedal signals on the right, but nothing on the left. So for these cases, we took her to the operating room and did a diagnostic arteriogram. I think you can appreciate there the disease there below the knee. There's reconstitution of the anterior tibial artery, limited reconstitution of the posterior tibial and peroneal arteries. And so we were early adopters when the Pounce thrombectomy system first came on the market and have used it in many different situations. And although we have some other techniques or materials at our disposal with how good this particular device has performed, it's typically one of the first devices that we pull off the shelf. So we crossed into the peroneal, we exchanged the catheter using we use the exchange catheter, place a retrieval basket into the area of the occlusion. Our funnel was deployed proximally, and with two total passes, I'm sorry, there's supposed to be a animation there. With 2 total passes, we reestablished flow through the popliteal artery and into the anterior tibial artery. The peroneal artery. And we had residual occlusion of the anterior tibial artery. We recanalized that as well. And now that patient left the suite with inline flow to the left foot. So mission accomplished. Total case time, very, very quickly. And sometimes the time is not adequately captured on these cases, but time is tissue, especially when patients have the similar demographics as well as the issues with her left foot that this patient had. Off the table, she had a left DP pulse. She got a workup for embolism, which was negative, but then she was started on Eliquis and did well.